Welcome viewers to a new episode of Week Clinic. I remain your anchor, Olisa Obi. In the studio, we're having a public health specialist that will be talking about M-Pox, previously known as Monkeypox. He's going to tell us everything we need to know about Monkeypox and the myths, the common features and treatment options available in Nigeria and worldwide. Please, if you have not subscribed to our channel below, kindly like, subscribe, comment on our comment section, share. Do not forget to click on the notification button for more interesting episodes. Good day, doctor. You're welcome to our show for today. So, can we get to know you, sir?
Good day. Thank you for inviting me. I'm Dr. Guembe Ebiowei on Department of Community Medicine.
Can you explain what monkeypox means, or M-Pox, as is the common name now for it?
M-Pox, yes, commonly called monkeypox, is a rare zoonotic infection. Zoonotic is an infection transmitted from animals to humans under the right conditions. And since 2022, it has been declared as public health emergency of international concern by WHO. And since this August, it has also been declared as a public health emergency of international concern due to the increasing incidence, especially in the DRC Congo. So, since 2022 till now, there have been about 17,000 cases worldwide with about 500 deaths worldwide. Most of them are in the DRC Congo. In Nigeria, there have been about 32 confirmed cases with 0 deaths. While in the Borno State, there have been a confirmed case and 12 suspected cases with 0 deaths.
All right, thank you, sir. So, what are the common symptoms of monkeypox and how does it present?
Yes, good question. The common symptoms of monkeypox. The symptoms can vary, but the commonest symptoms are one, fever. Then 1 to 2 days after the fever, the appearance of a characteristic rash, starting from the face and the soles of the palm and the soles of the leg. Once you see the rash, you will never forget that kind of rash. It's very different from other types of rash like measles and chickenpox. Last symptoms include poor appetite, chills, you're feeling cold inside, poor appetite, chills, headache, waist pain, joint pains, tiredness, or even diarrhea in some patients. I also wanted to talk about the history of this mpox. It was first discovered in 1958 in some research monkeys in Denmark. Then the first case of human transmission was in 1970 in a 9-month-old baby from DRC Congo. This mpox is mostly localized in the forest regions of Central and West Africa. And rising cases this year were mostly centered around the DRC Congo because of the war and the other things. So mpox has been declared as a public health emergency of international concern because of increased travel and globalization. Disease can be easily spread from one point to the other, so it was right that WHO declared it as a public health emergency of international concern.
How does monkeypox spread?
Thank you. That's a good question. Monkeypox spreads when there's direct contacts. An infected case of monkey mpox, there's direct contacts. If you're in contact with somebody that's infected with mpox, and if you're in contact with the bed sheets, clothing, other affected materials of the infected person. Also through animals, if they're infected, like squirrels, monkeys, and rodents. Those are the 3 commonest methods of transmission. So through direct contacts. Now,
Okay, so I want to ask: is monkeypox spread via sexual contact, or kissing, hugging, or eating from the same plate?
thank you. That's a good question. There have been several controversies and misinformation about mpox. So I will address that one now. Some people say mpox is a side effect of the COVID-19 vaccine that was given during the COVID-19 corona epidemic. And I want to come out and say it's not a side effect because mpox and COVID-19 vaccines are two coronavirus are two different viruses. Coronavirus had the worldwide distribution, while mpox is localized to West and Central Africa. Also, it's not transmitted through sexual intercourse, but can be contacted during sex because of the direct contact, skin to skin contact, because of direct contact between the participating people during the sexual sex, but it's not through sex per se.
Doctor, what are the primary methods for diagnosing monkeypox?
Yes, thank you. That's a good question. The prime method for diagnosing M-Pox is collecting swab from the skin rash and taking it to the lab. You can also collect blood sample from the affected patient or suspected patient and send to the lab to do antibodies. To collect the blood, send to the lab, see if there is antibodies to M-Pox. Those are the two commonest methods used to diagnose M-Pox. Other methods can also diagnose it clinically because of the characteristic rash. The rashes are very characteristics of M-Pox. Once you see those rashes, the big rashes, you know that it's M-Pox. Once you see those rashes, you know, not forget those rashes. They are very different from that rashes, like measles and chickenpox, or even drug-associated allergies.
Okay, thank you, Doc. So, what are the treatment options available for treatment of mpox in Nigeria and maybe in the world?
M-Pox is mostly a self-limiting disease. Within 2 to 4 weeks, most of the patients get better. But in those severe cases, like 1% of the cases, it can be very severe. And those ones are mostly in children less than 5 years, pregnant women, people that have immunodeficiency like HIV, diabetes, and elderly patients. You can have very severe disease. Those ones you can place them on antivirals and also immunoglobulins. But the most treatment is supportive. Give analgesic for pain, give paracetamol for fever, also use give antibiotics for secondary bacterial infections. Those are mostly supportive treatments. So within 2 to 3 weeks, most of the scabs, the rashes will heal off, the patient will get better. So the major thing is just to isolate the patient, give him supportive care. After some time, patient will be healed. The patient can go about his normal business.
All right, thank you very much for this clarification. Please, this self-limiting, what do you understand by self-limiting? Because you said you treat most patients, the disease is self-limiting. So let's understand what you mean by this
That
self-limiting.
means it goes by itself. The body fights off the infection and the body heals itself. You don't really need to take a particular treatment. The treatment you're taking just to for those symptoms like the fever, the body aches, and to prevent secondary bacterial infection because of the rashes. That's why mostly the body that means the body will take care of the disease. You don't really need to. There is no particular treatment per se. You understand?
That is great. How effective are these treatment options?
The supportive therapies,
Yes, how effective
they're
are
very
they?
effective. We know the paracetamol, we know ibuprofen, we know and we mostly to prevent to treat fever and pains, also prevent secondary bacterial infection. They're very effective. And if the patient is dehydrated, you can also place an IV fluids. All those are very effective.
Great. Very much, doctor, for this explanation. So, how do healthcare providers distinguish the rash from monkeypox or mpox from other skin lesions, like you said earlier, chickenpox and measles?
Yes, that is a good question. Many people have asked me, some of my relatives and friends. So the most common disease that can be mistaken for chickenpox is chickenpox. That can be mistaken for mpox is chickenpox, measles, scabies, even some drug medication associated allergies, like the one we call Steven Johnson syndrome. But the rash of mpox usually starts from the face and spreads to the palms of the soles of the palm and the soles of the feet. So the one of measles starts from the face and the back of the ear and spreads. One of chickenpox usually spreads from the body and downwards. Also, the one of the rash of mpox grows gradually. Like one of chickenpox and measles grows rapidly within 2 or 3 days all over the body. And also, the rash of mpox is bigger than those rashes. They are raised and big rash with some vesicles inside, with fluid vesicles inside. So once you see those rashes, you can't mistake it for something else. Also, measles can come with red eyes, dry cough, and running nose, which might not be common in chickenpox and mpox. Also, in measles, there's what we call complete spots, which can be found in the cheek of the patient. You see some whitish spots around the inside the cheek. Those ones that are very found to use the pathognomic of measles. Once you see those already whitish spots in the cheek, you know that most likely, highly like this measles. It's not M-Pox or chickenpox. So those are the small difference between the rashes.
Okay, thank you very much, doctor, for this detailed explanation. So, what measures can we as individuals, the community, and the country take in
Okay,
controlling this mpox virus?
okay. One, practice safe hygiene. Wash your hands before touching your pet, before touching cooking, and first after slaughtering any animals like rodents, squirrels, because there can be carriers. Also, avoid people that have the characteristic rash of mpox. Practice safe hygiene. If you have the rashes and fever, present to a health facility. Then for health workers, they should have a high index of suspicion of for patients presenting some rashes and fever, isolate them, then diagnose and treat them for mpox. The major thing is just healthy living, good hygiene, wash your hands, and cook your meat thoroughly. Those are the basic things.
All right, thank you, doc. So, what will be your last words for viewers concerning mpox?
Mpox is an ongoing event in the world, and the World Health Organization has declared it as a public health emergency of international concern. So everybody should be on the lookout. Look out for those rashes, for the fever, if possible, isolate yourself, present to the health facility, and they will isolate you, diagnose you, and treat you. Yeah, mostly it's mostly self-limiting. So major thing just to practice safe hygiene. I think
All right, thank you, Dr. Guembe, for coming to this program and telling us and explaining details about mpox. Really appreciate it. Well done, thank you.
thank you for inviting me, having me in your program.
Thank you viewers for watching today's episodes on Week Clinic. Um, we hope you have learned a lot about Mpox, previously known as Monkeypox. And big thank you to our guest in the studio, Dr. Guimbe, for throwing light on Mpox, previously known as Monkeypox. If you have not subscribed to our channel, kindly like, subscribe, comment, share. Do not forget to click on the notification button for more interesting episodes.